The University of Maine is celebrating students in the School of Nursing.
There was a pizza party on the Orono campus to recognize the heroic healthcare achievements of more than 420 School of Nursing students who actually entered the workforce to help respond to the pandemic. They included students, recent graduates, faculty, and staff. UMaine officials say it's estimated that they have been responsible for administering nearly 10,000 COVID-19 vaccinations statewide. We spoke with several of the students about why they wanted a nursing career and what their biggest concerns were about entering the field.
I decided to get into nursing. My grandmother was a nurse, and growing up I loved talking to her and hearing her stories about patients, and I really love the scientific approach to nursing and what the body does and learning about all the science behind it, but also the patient-centered approach and really getting to know your patients and treat them holistically.
I have a big hobby and passion for medical sciences, and I want to do something that could also care and be empathetic towards patients, and so this was a good combination of both.
So I mainly decided to get into nursing because I just have a few family members that are in it, and I just think that I always looked up to them, and I always thought it was such a fulfilling career. And I don't know, I always thought I could become passionate about it, and I seem to be so far. I really enjoy it.
I lost a family member to COVID last summer as well, but it just means that there's so much more for us to be able to do now as nursing students.
I went to nursing because I just really like the medical field. I knew I didn't want to be a doctor and go through that schooling, and I just really like helping the public and such.
I got into nursing because as a kid I have a heart condition, so I spent a lot of time in the hospitals. My father has a brain tumor, so I really liked that area and how much they helped when I was a kid and with my father, really just paying back for what they did for me.
My biggest fear is messing up on a patient. I think that's everyone's biggest fear in nursing, but I think we're taught correctly here, and I don't know, nursing here has taught me so much and it's been so great, so I think I don't see that becoming an issue, but that would be my biggest fear.
Just when I graduate, the continuing shortage, because there's problems with burnout and everything, so be a new grad and just short staffing.
I think getting into nursing right now, especially during the pandemic and with the surge of COVID patients in Maine, you really set yourself up for burnout and compassion fatigue, and you work extremely long 12-hour shifts and in PPE and with sometimes patients who are really scared, and so they may be not the nicest, but I think it's also a really fulfilling opportunity to make a difference in someone's life and to help treat somebody and to really make a difference.
And good luck to those new graduates and students.